What's up, you guys? It's Nikita Lene back with another video. Today I'm going to be talking to you guys about my experience as a PACU nurse and the ICU nurse and letting you guys know which one I like better. So starting off with the ICU, I have worked as an ICU nurse for, I guess you could say the full 3 years of me being a nurse. I initially started off in Surg, and as you guys may or may not know, my job immediately started floating me to the ICU. At first I was taking like this lowest acuity patients that were pretty much just waiting for Surg beds, and then they slowly but surely just kind of trained me on the fly, I guess, on ICU until I did my full orientation to become an ICU, an official on paper ICU nurse. So pretty much most of my nursing career, I've already been in the ICU. And I switched to more acute level ICUs when the pandemic started. And so I really love the ICU. Things that I love about the ICU are the pace of everything. It's very fast paced for the most part. You don't really have like a lot of like downtime. For the most part, you're on your feet, you're going. I love the critical thinking portion of it. There's a lot of critical thinking, trying to work your way through and mind map through a lot of different disease processes and what your patients are going through. So I really enjoy that portion of the ICU. It makes it fun for me. It gives me a good mental challenge where I'm really constantly thinking critically about what's going on with my patient, what their patient outcome is, and how we can kind of bridge from where they are to where we want them to be. A lot of critical thinking about their medications and how they affect their bodies and the patient outcomes, all of that. That's like my absolute favorite portion of working in the ICU. Now, as far as specialties, I've had the opportunity to work in a lot of different types of ICUs throughout my time as a travel nurse. I have been traveling for, I guess, a year and like probably like 8-9 months, something like that. And so over that time, I've kind of been floated to different types of ICUs. So I've worked in surgical ICU. I've worked in like a catch-all ICU. And some hospitals, they just don't have a big enough hospital to have separate ICUs. So you just work in a unit where you get a mix of everything. I've worked in a neuro ICU, and I have been floated to CV ICU while I was working on my contract in Kentucky. And that was a whole experience. I would love to do a whole separate video on working in the CV ICU and the difference between CV ICU and regular ICU, as well as just my overall experience, because it was a doozy. But those are the specialty ICUs that I've worked in. For the most part, most of the ICUs that I've worked in have just been catch-all ICUs where the hospital doesn't have separate ICUs. So you just get a mixture of everything. It's all critical care. That's kind of my favorite, to be honest with you, because you get a mixture of things. So if you have 2 patients, you may have 2 different patients with 2 different diagnoses, and you're critically thinking through both of them throughout the shift. And so I kind of like that. That's kind of my jam and how I like to work, versus like when I worked in the neuro ICU, you're getting like majority neuro stuff. Neuro's not really my thing is what I will say. Although that ICU ended up turning into kind of like a catch-all with a focus on neuro. I don't know. This regular ICU, a mix is kind of like my favorite so far. As far as working PACU, I kind of gradually integrated myself into the PACU. A lot of the skills that you need to work in PACU, you already do working as an ICU nurse. We do a lot of pre-op stuff, taking care of our patients prior to them going to surgery. And then a lot of times when you work in the hospital, if your patient goes down to surgery, you're taking care of them shortly after their surgery. I will say the difference is that if you're in a hospital setting, you're getting your patients out of surgery a lot faster. I was like, this should not be a hard transition. And it really wasn't. So Working in the PACU, I worked in a catch-all PACU where it's an outpatient PACU, outpatient surgical center. And so we just give it a catch-all of everything. We do, the surgeons just book the ORs, and I take care of surgeries. Mostly it's eye surgeries like cataracts and things like that. Outside of that, there's ortho surgery like bone spurs, broken bones, and things like that. We have plastic surgeons that do their surgeries there. So BBLs, mommy makeovers. And then we just have like a bunch of just random, like taking out masses and lumps and just a bunch of random surgeries there. So I really enjoy that. The fact that there's a mix of everything coming in and out of that PACU, kind of refreshing. It kind of gives you once again a mixture of things that you're seeing and doing throughout the day, so your day doesn't end up being mundane and boring. So let's talk about my time working in the PACU. For those of you who don't know what the PACU is, it is a post-anesthesia care unit, and this is the unit where you're taking care of patients as soon as they come out of surgery. You are the first face that they see when they wake up from being under anesthesia. The care that you're taking in this unit is just primarily just helping your patient in that transition of waking up from anesthesia. And if you are in a hospital setting, you are making sure that they are stable and preparing them to go back to their unit that they are admitted to. If you are in an outpatient setting like I work at, then you are pretty much just making sure that that person is awake and alert enough to safely go home and get discharged to whoever is there to pick them up, their ride and their person who's going to be taking care of them at home. Let's talk about some of the similarities between the PACU and the ICU. One of the biggest similarities I will say is you run. You are constantly busy in both of them. And when I mean constantly, of course, there are peaks and valleys with all units that you're going to work on. There are times when the ICU, when your patients are like stable and calm, cool, and collected, and you may have like an hour of like a lull where you can sit down and chart. And it's kind of the same in the PACU sometimes, where we're just waiting on the next patient to come out. Maybe all 3 or 4 of our ORs are booked, and they are in there doing surgery, and we're just kind of waiting to see who's the next patient to come out. There are peaks and valleys, but for the most part, both of them keep you busy. You are on your feet, you are moving constantly, go, 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 go. The PACU is a little less of the running around, I would say, only because you have your bays that you're responsible for, and if you are assigned to those specific bays, then that's kind of where you stay, especially because you can't leave your patient until they are like awake enough for it to be safe. So you have to kind of stay right there until that patient wakes up, and then sometimes you can end up with another assignment of another patient and another patient, another patient. But that's the biggest similarity, is that you are constantly on the go. The next thing that I love about PACU and the ICU is the catch-all. I love the fact that when I work in either one, either like a regular ICU or in the PACU, I can get a combination of different things that I'm seeing throughout the day. In my PACU, I see a lot of different types of surgeries, and I may be, you know, taking care of like recovering all the patients who have their eye surgery in the morning, and then in midday I may have a bunch of ortho surgeries like bone spurs and broken bones, and then in the afternoon it may be like a bunch of plastic surgeries, so breast augmentations and BBLs and things like that. So I love the variety in my day. I also love the fact that I get to meet all of the different OR and surgery nurses that work with the different surgeons, and all the different anesthesiologists that come in and out. And the same thing with the ICU. I love the flexibility. I love having multiple patients who have different diagnoses so that I can treat and kind of see a lot of different things. The more you see, the more you learn. So I absolutely love that about both jobs. The next similarity between the ICU and the PACU that I love is the balance between working as an individual and teamwork. And both of them give you the autonomy to take care of your patient on your own. But if you need help, you have your teammates there to help you. And so I really enjoy that. I enjoy being able to take care of my patient and do my own thing and take care of my patient in my own way. And then if things go south or I need help pulling my patient up, ambulating my patient, if there's an emergency that happens, I know that I have a team of skilled professionals that are going to jump in and help me. So I love the balance of that individuality and teamwork in both settings. The next similarity between the ICU and the PACU is patient teaching. You do so much patient teaching in both environments. Now, in the ICU, the patient teaching is kind of like stretched out because you're doing patient teaching every single day that you're taking care of that patient, and you're kind of stretching it out over your 12-hour shift where you have a lot of teaching to do. You may be talking to them about different procedures, different diagnostic imaging that they have to get done, different medications, and you're doing a lot of teaching both with your patient and with your patient's family members. Whether they're at the bedside or over the phone, you're still having to do the exact same teaching with them that you did with your patient. So there's a lot of patient teaching that you're doing over a long period of time. Now, in the PACU, you're doing a lot of patient teaching, but it's more condensed. And what I mean by that is that in the PACU, your patients are not there for very long. So you're doing a lot of patient teaching with them in the pre-op portion, like before they go in for surgery. And then post-op, you're doing a lot of teaching with them. Mostly it's with their family, whoever their family member is or their loved one that's picking them up. That is the primary person that you're talking to, mostly because after someone's coming out of anesthesia, you could tell them anything. You know, they're not really going to retain most of it because they're under the influence of the anesthesia. It takes a long time for that anesthesia to get out of their system, which is primarily why we do patient teaching with them before their surgery. After their surgery, it's kind of the basic stuff that you go over with them, but the primary teaching is with their loved one, either at the bedside, just depending on, I guess, how your PACU is set up. So it may be at the bedside, or you'll do it over the phone with them before they come to pick their loved one up. But either way, it is a lot of teaching with both jobs. Next, let's talk about some differences. One of the biggest differences between working in the PACU and working in the ICU is how long you have your patients there. Now, in the PACU, I may deal with a patient for as little as like 20 minutes if they had a very simple surgery or procedure, up to like maybe a couple hours. I think maybe the longest patient I've recovered has maybe been about 5-6 hours, and that's after a very in-depth plastic surgery. But for the most part, your patients are in and out, and that's the objective, especially when you're working in an outpatient PACU, is to get them in and get them out. These are, for the most part, very simple surgeries that they have a quick recovery after the anesthesia because they're not under anesthesia for too long. And you're just making sure that that person is able to be conscious enough and is stable enough, and then you get them out the door. Where the ICU, it's complete opposite. You can end up having the same patient for well over a month. And maybe it's not consistently a month, but that person can be admitted in the hospital for over a month. So you may take care of them for, a 3-4 day stretch, and then you go have your days off, and you may end up with that patient again, or even maybe weeks later, you may end up with that patient, because they are in the hospital for very, very, very in-depth disease processes and different issues. And sometimes you have multiple issues stacked on top of one another where that patient is going to be in the hospital for an extended amount of time because they are so incredibly ill. So that's the biggest difference between working in the PACU and the ICU that kind of took me a little while to get used to when I switched over to the PACU, because I don't know, I love to talk to my patients, and I kind of get used to just talking to them, and my supervisor is like, get them in, get them out. If that person's ready to go, let them go home and recover. So that took me a little while to kind of get used to. The next difference is that you don't deal with families as much when you work in the PACU. Now, in the PACU, for the most part, like I said, in the pre-op portion, you're doing a lot of patient teaching directly with the patient. And by the time they get to the PACU, this is right after they're rolled out of surgery. And so you may deal with their family for a short period of time because you do some patient teaching with them over the phone or in person, but it's a very short period. Their family members are not super duper involved as much as they would be in the ICU setting. In the ICU setting, once again, the patient's there for an extended amount of time. So you really deal with their family members, sometimes multiple days a week. Sometimes family members will stay over depending on the circumstances. And so you're dealing with them for your entire 12-hour shift, multiple 12-hour shifts a week or in a row. And so there's a lot more patient-family encounters and interactions in the ICU setting. Now, one of the biggest differences between the ICU and the PACU are your primary focus. Now, every unit and specialty is going to have a different focus. And when you're working in ICU, your patients are very critically ill. So your primary focus is keeping them alive. And so you're doing a lot of critical thinking, you're doing a lot of interventions, you're constantly doing different things and changing and tweaking their care plan in order to get it right, in order to keep them alive and increase their level of health, because they are so incredibly sick. You're doing little things over a long period of time to get them better. Now, when you're working in the PACU, for the most part, you're already dealing with a healthy patient. Most of your patients that you're getting are coming in for, just basic same-day surgery. And even in a hospital setting, I would say when you're dealing with surgeries, you may have some sick patients, but for the most part, they have to be stable enough to go to surgery. So it really depends on what type of PACU you work in. If you're working in like a larger surgery center where you're dealing with trauma and things like that, then you may see sicker patients. But in my experience working in an outpatient surgery center, most of my patients are healthy and they're just coming in for a simple same-day surgery. They are in and out in literally hours. That is a huge difference, I would say. It's a very different feel. It's a lot lighter feel to go in, to be able to laugh and joke with your patients and their families. They're healthy. They're stable, and when they're coming out of surgery, your primary focus is not necessarily, oh, I got to keep them alive because they're critically ill, but it's more so I'm just trying to keep them just stable, and so I can get them home to their families. And so it's a lot lighter feel. It's a lot less stressful, I will say, because from the jump you're already dealing with mostly healthy patients. So you just got to keep them healthy and help them to get in and out of that hospital setting or that outpatient setting quickly and stable and healthy as they came in. So one of the other differences that I realized along the way that I did not like, you guys, is the instability of your schedule. So when you work in the PACU, especially when you work outpatient surgery is what I will say. If you work in outpatient surgery, you're working Monday through Friday. And once again, you're working days because that's usually when the surgeons are booking their surgeries. And so the difference is that your schedule is not like a set amount of hours. So I would go into work and maybe I am on the schedule to be there by 7:30, but there's no definitive end time. So sometimes I would work 5 hours and then they would say, okay, well, we have too many PACU nurses here and there's not enough surgery scheduled, so we're going to send you home early. There would be some days where they're like completely booked. Every single surgeon has booked the OR and you're there for 12-hour shifts. And so I really just didn't like the flexibility of that. I like knowing exactly how many hours a week I'm scheduled for in advance. I know I have my set guaranteed hours, and I know that if I want to work additional hours, I can say, okay, I'm going to pick up one extra shift, and I can tell you exactly how many hours I'm going to work, and I can work more, but I'm not going to end up with working less. And so I did not like the way my schedule ended up working out with working PACU, just because I'm coming into work at a set time and I don't know if I'm going to be there for 5 hours, for 10 hours, for 12 hours. And the other portion of that, I guess I should add, is the fact that I am working per diem. Their staff members get guaranteed amount of hours, but I am not a staff member. So the very first person to get sent home is always going to be the per diem nurse. And then after per diem is going to be anybody who works as like a contractor directly for that agency or directly for that hospital. And then after that, it's going to be their staff members. So if there were too many PACU nurses and not enough surgeries, I would always be the first person to be sent home. Additionally, they don't really want you to work overtime because they know that they're paying you a lot more than their staff members as well. So if they felt like you were creeping up on even getting close to, being at those full-time hours and you were going to go over, then you just wouldn't be able to work a shift the next day. Or you would maybe come in for only like 3 hours the next day. And to me, that kind of seemed annoying because I'm getting myself ready, driving all the way here. It was like a 30 to 40 minute commute and I'm only going to work 3 hours. Like, that's such a waste, because what am I going to do with the rest of my day? Especially when I blocked off my entire day. So I didn't really like that portion of it. I don't really like my schedule to be flexible. I like it to be very structured, so I know exactly what my paycheck's gonna look like on Friday, every Friday. All right, so finally, which do I like more, the PACU or the ICU? This one kind of took me a second to really think about because I really have things that I love about both of them. But if I have to be honest, I would say my favorite is the ICU. And the reasons I love the ICU are primarily because of the critical thinking piece. I think that it took me a long time to really build up my critical thinking skills and to mentally build myself up to be a strong critical care nurse. And I really love that aspect about my job as an ICU nurse. I enjoy critically thinking through problems. I enjoy the interactions in the ICU. The other thing I would say I love is the schedule. I love being able to work 3/12s and work night shift and be done for the week. Right now, I'm very blessed. My job has my schedule blocked. So I literally work Sunday, Monday, Tuesday every week. And then I have the rest of the week off. Like, that is such a good feeling to me. I really enjoy that. Versus working in the PACU, working in outpatient PACU, I work days. And I have to work Monday through Friday. It's not for me. I am not a Monday through Friday kind of girl. I enjoy having my time off. I enjoy having a set schedule. That's the other thing about working in the PACU is that you may think that you're going in for 10 hours, but your schedule kind of varies. And so I don't really like that. I enjoy having my set 12-hour shifts, working 3 of them, working nights, and taking my butt home and enjoying my 4 days off in a row. I would say the ICU is definitely my favorite. And it's kind of weird because I kind of looked at it sideways like, am I toxic? Because working in the ICU setting is a lot more toxic as far as the level of stress that you deal with and as far as some of the things that you deal with. It is a very stressful place to work. So I'm like, why do I really, really, really love the ICU? I guess it is just my love for not necessarily the chaos, but the critical thinking portion of it. And just the environment feels like home to me more so than the PACU. I do enjoy working in the PACU, and I am very blessed that the PACU that I work at here, it's a great environment. Everyone's so friendly, so nice, so welcoming. I really enjoy working there. It's a great feeling. I think it's a great place to work when I want to give myself a break away from the ICU, because like I said, to be able to work there for 4 weeks and not one patient died. That's a good feeling, you guys. I can't even describe it, how happy it made me feel working there. Like I said, they're both super duper busy. I was on my feet constantly, but working day shift Monday through Friday was just not for me. It just was exhausting to me, having to wake up in the middle of the day, deal with morning traffic versus night traffic. It was just too much. So I would have to say I love my toxic ICU environment. I love working nights. I love working 3 days a week. And I think that's probably, honestly, I don't know what I'm going to end up doing. I know that my time working bedside nursing altogether is going to be coming to an end soon. And so I'm kind of working on that transition and what that transition is going to look like. But I can't tell you for sure what that's going to look like. I do still enjoy working in the ICU, but I think that it would also just be a nice change of pace to be able to work in the PACU for a little bit longer. And maybe doing that per diem might be what I end up doing. We'll see. I'll definitely keep you guys posted on what I decide to do. I love sharing my journey with you guys, and if you work in the PACU or in the ICU, comment down below. I want to hear your experience. If you work both, which is your favorite? I look forward to reading your comments. Thanks again for joining me, you guys. Until next time.